All right, guys, and we are back. All right, I'm waiting for some of you all to come in. All right, so we are back and we are looking at health systems. So we introduced it a little bit earlier when we spoke about the purchasing of it. Um, Here we go. National or state funded, which is what we have as a very um, prominent feature in Trinidad and Tobago of national healthcare. Its characteristics that comes, it's universal coverage. So anyone walking into a facility, whether be it a local, one immigrant, whoever it is, can access from a basic bandage all the way to complex surgery. So it's universal coverage. It comes from general revenues, taxation, and government revenues. The strength side, it covers the entire population, and the weakness, of course, it will benefit the rich because it does not uh, it does not discriminate. Well, don't want to use the word discriminate, but it does not filter the income status of persons accessing national health care. And it's something that can be, you don't want to call it a drain. What you would say is that it ought to be better managed, in that if you have persons who can indeed afford health care, as in they have health insurance, as in they can pay out of pocket for their health care, then it should be encouraged that they do so rather than utilize the resources of the state, which can be then put to good use for persons who are not able. And remember, in the lecture we spoke about that graph on number 13 about the two groups, the low income, low age, and the high age group, the low income, low age, and the low income, high age group that would require subsidy help for healthcare. And finally, it's also sensitive to political pressures because remember, because it's national funded, your healthcare system can be determined by the new administration that would come in and perhaps want to make changes in your healthcare, make adjustments in your healthcare, make downsize healthcare, all of those things. So those are some characteristics, strengths, and weaknesses. The social healthcare system, Bismarckian, or we also call it Your group health insurance is funding that comes from your employer and your employee. The employee pays a small part and the employer pays a little bigger part. It pools the risk of everyone and tries to get coverage on a certain things. The strengths are is that it's a lower cost for the employee, and some weaknesses it still would exclude poor persons because for very poor persons they would still need healthcare and they may not have a job or they may not be able to work or they may not have access to enough funds to pay for healthcare. Um, Escalating costs can also now limit the amount of coverage you have in this option of healthcare. And next we have voluntary, which clearly it's you are paying out of pocket. That's as simple as you can get in explaining what this is. You want a healthcare service done, you have no health insurance, or you do not want to go to the public healthcare system, you have to go and pay out of pocket to get what it is you want to get. All right. And finally, we have the community-based health insurance, which is it's something that's not well known in our neck of the woods, as you say. Um, it's community-based, so you have a particular community that may be a particular age group of a particular health risk that can now pool together. And I can think of perhaps communities that have a large that people go to retire. For example, as in the U.S., a lot of persons go to Florida for retirement because Florida is a lot more warm. Florida is a little more tropical in nature, and people go there to retire. And as a result, you can now have community-based type insurance services that would be specific for a particular age group or for a particular health risk group. And some aspects of the healthcare market to be controlled, consumer moral hazard, and we can you go back to the CDAP example, or we could go back to any national healthcare service delivery example to say that because you are not paying for the item, you are now using the service unnecessarily, as we say in local parlance, because it's free. I pay in tax for that, so I have to go and get it. Now, that's a position that a lot of people take, and I hope that you all don't take that position because in the beginning of the lecture, I showed you that your health surcharge that you pay $8.25 per week is a very small amount of vapor or a vapor droplet towards how much it actually costs for healthcare service delivery. All right. So the consumer moral hazard is that you as a consumer don't utilize the service unnecessarily and allow for resources to get used up unnecessarily simply because it's free, simply because it's not a free drinks. Healthcare is not a free drinks party. It's not an all-inclusive line where you pay a high premium and you could go and have a good time and enjoy yourself. And no, healthcare is costly, and it is costly to maintain and provide. All right. And then we have adverse selection, whereas the best risk persons are selected for insurance, and you would know this if it is you do have a private health insurance. As students, the university usually would ask you for you all to do a chest X-ray, a TB test, and some other basic health things that would now put you in a particular risk pool, so that they can now afford to pay health insurance for you. Because I know at the university level, they pay for health insurance for you as well, and you have access to some of the top medical facilities in the country. So they look at the best risk individuals. Of course, if there are things that you have, the university may write you and say that you will, because of this, you will have to be excluded from our general student insurance. And those, so that's adverse selection. Finally, we have provider moral hazard, where you can look at any particular corrupt practices, incentives that both providers, whether be it pharmacists, physicians, or healthcare providers, and then healthcare suppliers can do to engage in corrupt type of activity um, for healthcare financing. All right, so some topics of interest. If you just taking a look at the graph as the amount government spends on health on the horizontal axis, and the percent of total expenditure on the vertical, and you would see where different countries are located on the graph. And I think I asked, I asked this in Farm Admin on Monday about which countries are known to be the gold standard for healthcare. And some, I know all of you would be in that class. So just remind me again, what are the countries that are known to be gold standards in healthcare internationally? Tell it to me. I'm watching out for it in the comments. All right. So you see where the US is, where it's neither public or private predominate. So I mean, in healthcare insurance coverage, the U.S. uses both Medicare, which is a government-based health insurance, and other competing health insurance agencies. All right, good. We got our answers. Perfect. So all of you all were in class. Great. And I'm happy to see you remembering. Netherlands, Samantha. Netherlands, I have to confirm that if it is, you'll have to give me some proof. But I'm not aware that Netherlands is a world leader in healthcare. But certainly Australia and New Zealand. So we have completed this lecture on health financing. I invite any questions before we go on to the other lecture. Hopefully we can get that other lecture done before we close off today. Any questions quickly? We're going to do next health ICT. So just tell me if you have any questions on this one we've just did on health financing. And we're going on to health ICT. And I sent these lectures to you already last week. Any questions, guys? No questions? After 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, no questions. So we're moving on to health ICT. But if you do have a question, still put it in there. When I come back, I'll take a look at the chat and answer you. All right, health ICT. So this year, this on slide number 2, you would actually get to see what some concepts in healthcare is about. I'm just fixing myself to change up position here. Healthcare is, or generally in the world, you might want to look at things from this perspective. What is equality? No questions, Marie. Okay, good. What is equality versus what is equity versus what is reality, and finally, what is liberation? And the point of health ICT is to create more liberation with respect to healthcare access and healthcare service delivery. So there are 3 persons looking on at a baseball game. And the first one on your left-hand side, equality, is where everyone is given the same platform to stand on to look at the match. A tall guy, a medium guy, and a short guy. Clearly, you can see if you give all of them without consideration, so your eyes are closed as to what their characteristics are, you're clearly going to see that you're now giving the tall guy an advantage over everyone else because he already has a natural resource or a natural advantage. Next to that, you'd see what equity looks like. And equity is where you now you open your eyes and you assess and you see the different characteristics of persons and know how to assign and allocate resources. In healthcare, this is very important and it's a continuous work in progress to be providing equitable healthcare for those that need the most amount of help. They get the most amount of help. For those that do not need any help, then no help is offered or no help is given to them. And I know that there will be some of us who would think, well, isn't that discrimination that you are giving this person so much help, but I am getting none? Well, the reality is that from a position of equity, a consideration of equity, dear sir or dear ma'am, you are in a position to help yourself. You are in a position to reach the intended target, whereas this other person, this other group, needs a lot more help to experience the same thing that you are experiencing. So, by trying to facilitate everyone having the same experience, more help may be needed to be allocated and assigned to certain groups because of their natural disadvantage. On the third one, in the middle, you see what reality is. And the reality is that persons with the most amount of resource naturally end up getting the most amount of assistance. And they are well above everyone else in terms of position and view and experience. And then you have another one who can barely see and barely enjoy the experience. And then you have another group that is not only unable to see, but very far from being in a position from being able to see the match. And finally, we have liberation, where the barriers are removed and all persons can see the match based on no barrier being in front of them. So I hope this picture paints a very clear idea of what equity is, what equality is, what reality is, and what liberation is. And Health ICT intentions is to provide liberation to access the healthcare and healthcare delivery. Our health threats, and when we did this slide presentation, there was no ravaging epidemic. There was no pandemic, but the reality is there's population explosion, and we just spoke about that in the last PowerPoint. We're moving from 6.6 billion to 9 billion to 20 billion. Natural and social calamities. We have earthquakes, we have monsoons, um, we have nuclear disasters, we have wars. Wars is a social calamity. High level of infant and maternal mortality, whole list of problems that are health threats that you could see here. And the problems that are faced, increasing demands for healthcare funds, training of more healthcare practitioners, whether be it doctors, pharmacists, nurses, lab techs, radiographers, construction of new health facilities. Construction of a brick and mortar facility requires lots of funds. Investing more on health research. All of these are problems that have an economic impact on healthcare, health economics, pharmacoeconomics. There is declining resources for public health, There's poor coordination between medical facilities, and the body of knowledge in the medical field is expanding rapidly. But IT can help. Information communication technology can help as we move from a paper-based, physical-based to a more and um, software and internet-based. Access to healthcare can be fast, efficient, and cheap. Access to health information can be fast, efficient, and cheap. ICT is not limited to just transfer of information. It can help to improve decision making, to promote self-care, and we're actually going to do self-care later on in this course, and enhance the effectiveness of health institutions, also providing professional support. ICT can come in various forms: electronic medical records, hospital information system, intranets, extranets, public health networks, telemedicine, community health information systems. Just looking at your questions here for the exam. Right. Um, so it's not just electronic medical records, it's hospital information system, the integration of all departments in or all departments within a facility, and integration of several facilities information into one. Well, now we have the cloud, so now there's no need for every organization to have large backup stores. Microsoft, Google, I believe Oracle as well. Their largest revenue earners now is in cloud storage. So use of ICT in improving the efficiency of your pharmacy operations, of your ward operations, of your administrative operations, all feeding into one group. You can have data from your wards, data from your pharmacy services of patients, all working together to help to find the best possible solutions to your patients. Application of ICT can improve efficiency, can help with inventory management, inventory controls, can help with forecasting, can help with information dissemination, can help with so many things. It mitigates the shortage of healthcare workers, basic health services. ICT can be used to do video conferencing, or simple WhatsApp video calls to interact with your patients. So your patients don't necessarily have to physically be here to now sit and chat with you. They can come, you can have their medication, just as it's done in Canada, where everything is done in advance, where you come, pick up, collect. So your time in the facility is less. Your time in the facility is less, therefore your risk is less. ICT is flexible, interactive, and can reach a large population. It has effective and timely delivery of service. It can help to balance the urban-rural disparity of services. Because we have a small population in Matlot, which is very far. To get to Matlot from Sandy Grande or from Valencia is another 2 hours from that location. And that can be a deterrent for health professionals to be able to go to Matlot and provide a service and have to come back to another location and provide another service. Some of these services can be done via telehealth, via use of ICT, using ICT for public education. All right, demonstration of how things are done. In some of those rural areas, some some patients are not able to have transport or readily have available transport that you can go out on the bus route right in St. Augustine and take a PBR Maxi and go to east or west. In rural areas, they don't have easy access to transport to get to the hospital service. But if we do have application of ICT, some patients can sit in the comfort of their home and access a health service. ICT can be applied to primary health care. ICT helps with equitable in providing an equitable healthcare approach. So the purpose of ICT in healthcare is to have all your clinical information being able to be fed into one location that the clinicians can now make better decisions on each patient. And that data can be collated well for purposes of research. For research, we are we are a country that isn't very good in doing research, and that's because data isn't collected very well. ICT can help solve that. We have had we have had a thrust of getting ICT done in our country just shy of 10 years ago. I mean, it could be a little more. We had some consultants from Argentina and other countries that came and they made proposals, and for some reason or the other, those proposals were not adopted to have a national health service that is driven by ICT. All right, I spoke about research using ICT to help collate and collect data for the purposes of research. So ICT, in summary, can help with improving the efficiency and the effectiveness of your own department, whether be it your pharmacy, your ward, your inventory, your stores room, your records, all of which can be now fed into one system that can be used in decision making. And with this current pandemic, ICT can be used in creative ways in which you can reach your patients without your patients having to physically attend your brick and mortar facility. So ICT is certainly the way to go. ICT is definitely has a role, and when you become a healthcare manager, I want you to always be looking out for the use and application of information communications technology to help with the efficiency and effectiveness of your organization. All right. So I invite any questions. We've come to the end of today's session. Any questions, any queries, guys? Your exam is going to be next week, Friday, and it's going to be based on these three lectures that we did. Um, it's two questions, so I'm not sure which is going to be selected, but I have submitted a question on each lecture for next Friday. Yes, Shakila, next Friday. So I submitted three questions for him to consider. If I'm not sure if all three are going to be used, or just most likely maybe two. And yep, we're going to take it from there. Are we good? Any questions? Any queries, guys? The exam, all exams, because they're online, they're going to be due in, I think it's 48 hours. 48 hours in which to get it done. Sarah, you have familiarity with this because I remember correcting some papers with your name on it. So you know how it's the same way it was done in summer. No MCQs, only essay type questions. I'm repeating, should be 500 words or less, should not, I repeat, should not be long, elaborate, and unnecessary, should be structured well, should be well written. For the community, it's Wednesday or Tuesday. It's Wednesday. Community is Wednesday, the Wednesday of next week. In text citations, of course, please do your citations. Good? No more questions? All right. So, see you all. You all have my phone number. You can WhatsApp me if you have any questions outside of the class time. I will help as much as I can within my limits. So, have a good day, have a good week, and I shall see you all next week. So long.